I'm Dr. Jamalette Alegria. I am a board certified pediatrician and I have the goal of helping every child to thrive and have their healthiest life. Today I want to talk about something called PANS. So I did a video about pandas and you can find that if you scroll through my page, Jamalette Alegria MD. You can find that video and I talk all about what PANDAS is. As a quick reminder, PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. And I go into a lot of detail in the other video that you can find all about pandas, talking about what it is exactly, what it looks like, what the onset is, and it has a lot of really good information. So if you haven't watched it yet, I hope you go and find it, watch it, share it, because pandas is a lot more prevalent than many of us think. Today I want to talk about PANS, and PANS and pandas are very similar to each other. I just want to put this out there. Do you know a child, or is there a child in your home or a child that you know who has had a sudden onset of symptoms that are concerning? Behavioral changes, restrictive eating, anxiety, tics, personality changes, decline in school performance, decline in ability to concentrate or to carry out tasks that used to be easy for the child. All of this could be something called PANS. PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. PANS was first described in 2012 by Dr. Susan Sweeto, who also described pandas years before that. PANS and pandas have both been described in the literature for many, many years and are real, distinct, true diagnoses that many doctors are not aware of or looking for when they see patients who present with these kinds of symptoms. Often these kids are misdiagnosed as having a primary psychiatric disorder or misdiagnosed as having ADHD or other just straight anxiety, straight OCD, but there's so much more to it than that, and I want to make sure that you know what this is so that if you know somebody who's going through this, you're able to give them this information and hopefully they can present it to their physician and try to dig for more answers and get more information. So PANS is something that can be triggered by infections other than strep, or even triggers that are not infectious. So with pandas, it's very clear that pandas is triggered by a strep infection. This is a group A strep infection, strep pyogenes. This is an infection either of the throat, in the nose, of the perianal area, or a skin infection that's caused by strep. I have seen pandas patients triggered by impetigo that was caused by strep. Not always going to be strep throat, and it's not always going to be obvious symptoms of strep throat. So that's pandas, and I talk a whole lot more about pandas, like I said, in the other video strictly about pandas that I have posted. PANS is broader than pandas because it covers triggers outside of strep. Infectious triggers that can be associated with PANS are either bacterial or viral infections. I have seen a lot of PANS triggered by Mycoplasma pneumoniae infection. So Mycoplasma is a bacteria that causes most commonly a disease called just walking pneumonia. So if you know somebody who has had walking pneumonia, typically it's pneumonia that is in both lungs. It kind of covers all the space, but it isn't usually bad enough to require hospitalization. Oftentimes it's treated with antibiotics on the outpatient setting, or a lot of people have it and they don't even know it, and maybe it goes away, or we think it goes away on its own without antibiotic treatment. But mycoplasma can do other things too. It's a little bit tricky of a bacteria, and a lot of times when we find that a patient has had mycoplasma or exposure to mycoplasma, the parents give me a very puzzled look and say, My child has never had pneumonia. I'm not sure how or when they got this, but it is something that that is a very common trigger. And when we find it and we start to treat it, kids improve and they get better, and it's awesome. Other triggers that I can see often are things like Epstein-Barr virus, which is the virus that causes mono, other viral infections, and just, you know, we can't look for every single bacteria and virus that's out there. And so a lot of times we don't find the infectious trigger, but we have very strong suspicions that there is an infectious trigger. So, so really doing some lab tests, obviously checking for strep because strep is a trigger for pandas, which is a category within PANS, but checking for some other typical bacteria and viruses that could be triggers for PANS. It is, symptom-wise, it's an abrupt, dramatic onset of obsessive compulsive disorder or severely restricted food intake. So those are the hallmarks of PANS. Unlike with pandas, where you most often will see motor tics or auditory tics or other sorts of tics in the patient, tics are not a required piece of the diagnosis for PANS. With PANS, it's really OCD, or obsessive compulsive behaviors, and I'm going to talk a little bit more about what that can look like, and or restricted food intake, and that in and of itself is often tied to the OCD. And so OCD is the main component, as well as possible food restriction. And then there also have to be some other neuropsychiatric symptoms. And those generally have the same severe acute onset. These can be anything from the list I'm about to give you. And you don't have to have all of these. You really just have to meet the criteria for PANS, you only have to have 2 of the following kinds of symptoms, in addition to OCD and or restricted food intake. So one is anxiety, or severe emotional lability, or depression. So a sudden onset of anxiety, often separation anxiety, is a really big piece of this. So I have patients who will not leave their mother's side. These are patients that used to go to school successfully, drop-offs were never a problem. Suddenly they must know where mom is. They must always know where she is. If mom leaves, they are texting or calling her every minute to check in and make sure that mom is okay. And it's usually tied to a really specific fear that something is going to happen to their mother or to their father or to whoever else they have a significant separation anxiety with. And so that is a very common form of anxiety in these kids. Other sorts of anxieties will present, and often phobias. So there can be a significant fear of thunderstorms or a significant fear of vomiting or choking. That's a very common anxiety or fear or phobia that I see in patients with PANS. And often the fear of vomiting or fear of choking is very tied to the food restriction. So that's something to keep in mind. Sometimes these kids have such severe food restriction, just going back to that, that they're misdiagnosed as having a primary eating disorder. And in the end, it's not that at all. It's a fear or phobia based or an OCD based restricted eating that isn't anorexia or a primary eating disorder. But it does often lead to symptoms similar to an eating disorder in that they are restricting their eating and maybe even having physical signs and symptoms of an eating disorder like severe weight loss, abnormalities in their vital signs, maybe slow heart rate or low blood pressure, or orthostatic hypotension, meaning when they stand up they feel faint and their blood pressure drops and their heart rate rises. So you can see that due to the eating restriction that you can have with PANS, but it's not a primary eating disorder. In the treatment, though there are some similarities in sort of the psychological approach to it, the treatment for PANS is actually very different than you would have treatment for an eating disorder. So back to the anxiety, it's a severe, sudden onset, often very debilitating anxiety. There can also be depression. It doesn't have to be anxiety. I have seen kids with PANS present with sudden onset severe depression, suicidal ideation, suicidal talk, and not necessarily have the anxiety symptoms. So sudden onset of depression in a child who was otherwise healthy, thriving, doing well, that's not normal, and PANS is something that I would absolutely recommend looking into. Emotional lability. This is a big one. These are kids that can be okay one second and then triggered the next to have a sudden huge meltdown, to just be inconsolable, screaming, crying, throwing things, and then the next minute, as if nothing happened, be back to themselves, at least briefly. And so that emotional lability is very concerning to parents. The next category of things that that can present with PANS is irritability, aggression, or very severely oppositional behaviors. And so these children are, again, similar to the emotional lability. They can be very, very irritable. They can be okay one minute and then just be triggered into a complete meltdown. I hear about aggression and violence. I hear about attacking parents, attacking siblings. These are children who were fine before, who never did any of this. This is not normal or typical behavior for them. So that kind of aggression is something that, if it's sudden and onset, it's not normal. Obviously, there can be triggers outside of PANS. Obviously, there are other things that can lead children to do this, but looking into PANS is really, really important in these cases. Being severely oppositional, defiant, that defiance that maybe they never really had. You know, there's a level of typical pushing boundaries that children have, and then there's outward oppositional defiant behavior. And you know, that's actually a diagnosis, oppositional defiant disorder. You know, I wonder how many kids who have been diagnosed with that actually have an underlying diagnosis of PANS. So it's something to really think about. Next thing that you can have with PANS is behavioral or developmental regression. So this could be a child who was independently able to get themselves dressed, showered in the morning, get ready for school, go to school, be able to manage all day, come home, do their homework. A child who was functioning normally and developmentally normally, to suddenly being a child who may no longer be able to independently do some of these things. There's a lot of parents who come to me with a complaint of baby talk. This is an 8 or 9-year-old who suddenly is talking like a 2-year-old now, having some baby talk. That's a very common developmental regression. Having accidents, urinary accidents, daytime and nighttime, that's a regression. That's also a symptom we'll talk about as well in and of itself that can be a sign or symptom of PANS. But any developmental regression in a child is something that is obviously not normal and something that we would want to look into for them and maybe look into PANS. The next is deterioration in school performance. So if you know a child who was doing great and then all of a sudden they're unable to do their homework, unable to understand things that used to be easy for them. Two areas that tend to be the most difficult or the biggest changes that you might see are in their handwriting. Handwriting absolutely can deteriorate, as well as math. Math tends to be a really difficult one. When somebody has PANS, their math skills tend to deteriorate also. So any change in school performance, any change in academic abilities on a child that you know has intelligence and has been able to academically achieve before and suddenly is not able to, changes in handwriting, inability to spell when they were able to spell before, inability to process or comprehend what they're reading, or even difficulty reading that's sudden and onset. Those are all things that you would want to bring up to the child's pediatrician and see what's going on here. And it's not always going to be ADHD or a primary learning disorder, especially if the child was doing well up until that point. Really would want this child's doctor to look into PANS as a possible reason for these symptoms. Next is sensory or motor abnormalities. So I have seen children who suddenly develop signs and symptoms of sensory processing disorder, and that can look like significant um, phonophobia, or just loud noises bothering them, needing to wear headphones to cover their ears to protect them from loud noises, photophobia, or brightness and bright lights that really suddenly bother them. But the noise tends to be the biggest bother, and then physical, being bothered physically by things like socks and underwear. I've had kids that will refuse to wear underwear because of the way it feels on their body. Their sensory integration has changed, and suddenly they have developed signs of a sensory processing disorder that they never had before. I have kids that will only wear a specific kind of legging or a specific kind of shirt without a tag, will not wear socks or only wear certain socks. So all of that is very specific, and it's very, if it's new and it's sudden in onset, I urge you to bring this up and to really look into the possibility of PANS if there are other symptoms that go along with it. Finally, there can be somatic signs and symptoms. That's things like sleep disturbances. Used to sleep through the night, used to have no trouble falling asleep. Now they're up until 2, 3, 4 in the morning, or waking up every hour, or unable to stay asleep, unable to fall asleep, or wanting to sleep all day long. So any changes in their sleep habits that seem sudden and severe, that would be a somatic disturbance. The other big one that I brought up earlier, but I want to talk more about here, is urinary changes. So this can be anything from urinary frequency, urinary urgency, enuresis, meaning wetting the bed or wetting their pants or underwear, or having accidents during the day. These are kids that were potty trained for years, suddenly wetting the bed at night, or suddenly having urinary accidents during the day. Or that frequency and urgency. They go to the bathroom, they feel like they have to go 20 minutes later, 10 minutes later. They walk in a new building that they've never been in, and they must go to the bathroom and know where it is so that they can be able to go if and when they have to. I often have to write notes for these patients for school, for them to be allowed to go to the bathroom as much as they need to, because they have this frequency and urgency of urination. And obviously we rule out urinary tract infections, and every single time it's ruled out. It's not a UTI, but they have symptoms similar to a UTI of just having that urgency and feeling like they have to go all the time. And so that is a very common sign of PANS, and it's very common specifically with mycoplasma, but other triggers can be triggers for that particular symptom. So we talked a little bit about what it looks like, sudden onset OCD or restricted food intake, as well as two of the other signs that we talked about, two things within these categories: anxiety, depression, emotional lability, irritability, developmental regression, deterioration in school performance, sensory or motor abnormalities, which can include tics, which I didn't say, but absolutely can include tics. It just doesn't have to. And then somatic signs and symptoms like sleep disturbances, urinary accidents, or urinary frequency. So we talked about what it looks like. And really the diagnosis is made clinically. It's made based on, does the child have a sudden, acute, severe onset of these things? And if they do, that's PANS. We can do lab tests, we can look for triggers, we can figure out what else might be causing it, but really that's PANS. And then moving forward, knowing that and being able to treat it is the next step. But let's talk a little bit more about what triggers can be. So I talked about some of the infectious triggers. We can do a lot of digging for what those are. We don't always find them, but infectious triggers are absolutely a very large majority of patients with PANS have infectious triggers. Other triggers are environmental. So I have PANS, patients who have PANS who are triggered by seasonal allergies, especially living here in Georgia. The spring is brutal. The pollen is Ridiculous. I grew up in Southern California, have had allergies my whole life. Moving to Georgia, it is another world here as far as the seasonal allergies with the pollen and just how bad it can be. People in Georgia with their spring allergies are suffering for a couple months every year. But kids with PANS who are triggered by seasonal allergies, I mean, spring is tough. And I have patients who flare every single year in the spring due to their environmental allergies. So allergies are a big trigger. Other triggers are environmental toxins. So we are surrounded by environmental toxins. There are heavy metals all around us. Heavy metals enter our bodies all the time through lots of different ways, and those toxins can be triggers for PANS. I have had patients triggered by being at a sporting event where the grass had been sprayed with some sort of herbicide or pesticide, and after being at that sporting event, they had the sudden onset of PANS symptoms. So definitely environmental toxins are a big possible trigger. What I have found in practice is that it's usually not just one thing. We can find things and we can say, okay, there's a little bit of this and a little bit of that, and all of these different things are contributing to the fact that you've had these symptoms. None of us live in a perfectly clean, organic world. We are surrounded by chemicals and toxicants all the time. Different situations, different experiences that every child has had, illnesses that they've had, antibiotic courses that they have needed. The gut function has changed with each of those. Immune systems have been hit by multiple different triggers, and so usually it's sort of a stacked process where you had this and you recovered and you were okay, but never fully recovered, and then you got this next thing and it didn't really affect you too much, and then you got this, and then you got this, and then suddenly you got that mycoplasma infection that put you over the edge to have these sudden onset of symptoms. But had you not had all that other stuff, you may not have reached that threshold. You may have not had that autoimmune response that caused the neuroinflammation that led to you having these symptoms. Had you not had that concussion 6 months before you got the mycoplasma infection, it may not have triggered you to have the PANS. And so I often find that we can really work really hard on treating that infectious trigger, but until we really get to the bottom of all the other things that child has had exposure to that has led to further predisposition to having the symptoms, we're not going to be able to make a whole lot of headway. So that's kind of the big picture on PANS. PANS can be triggered by both infectious and non-infectious triggers. Those non-infectious triggers can be almost anything, and so it's really vague, but it's also a clinical diagnosis. So if we don't find the trigger, we still treat. We still do everything we can to treat that child. And I'm going to do a whole other video about treatment for PANS and PANDAS. I just wanted to really introduce the topic here because it is a clinically defined diagnosis. Children who meet these criteria absolutely have PANS, and if they have PANS, the first step is to acknowledge it, diagnose it, and then move forward in trying to get it treated. And so I encourage you to share this video with somebody who needs to see it. If you know somebody who is struggling with a child that might have some of these symptoms, absolutely share this with them. Encourage them to seek medical attention for these symptoms if they haven't already. Encourage them to share information about PANS and PANDAS with their physician, because only through sharing of knowledge are people going to be able to know more about it and be able to acknowledge it and treat it. And not every doctor is comfortable with treating PANS and PANDAS. I will tell you, lots of doctors out there don't believe that it's a thing. And I am really working so hard to share this information because it absolutely is real. I have seen hundreds of patients who have presented with PANS or PANDAS, and every single child has a little bit of a different story, but every single child has the potential for full and complete healing once you acknowledge it, diagnose it, and move forward in treatment. And we have seen children healed from this. And so I want to make sure that the word gets out there, that people learn about it, and that they are able to present it to their providers, and that those providers, if they're not comfortable, at least acknowledge it and refer to somebody who is able to address it and help get them treated. I am going to share some links when I post this on the Pandas and Pans network, because through there on the website you can find physicians who are capable and willing to treat patients with PANS and PANDAS, and that's one way to find a provider who's able to do that. But a lot of doctors do know about this. A lot of pediatricians will attempt to treat, and sometimes treatment doesn't have to be long and drawn out. Some patients get better fairly quickly, and it's only if and when they don't that referral to somebody more specialized who has more experience with it might be necessary. So that's it for today. PANS in a nutshell: what it is, what it looks like, when to look for it, and how to ask for help for it. I am going to do more videos because I think that sharing this information is so crucial and important for our children. I am going to do videos about diagnosis, videos about some treatment modalities, videos about essential oils that can be used to help with some of the symptoms, videos about some other supplements and other sorts of nutritional support that can help with PANS and PANDAS, dietary things that can help with PANS and PANDAS. There are so many ways that we can approach this, and one thing alone isn't going to help, right? One thing alone isn't going to make this better. We need to really look at the whole child and really help heal them from the inside out. So that's it for today. Please share this with somebody who needs to hear it or needs to see it, and just hoping that you have a wonderful day, and really just looking for vibrant health for everybody who's watched this. Thank you, and take care.